We now have the sickest population of children that we've ever had in the United States. All of a sudden, their child stopped developing and they regressed. It was like a flip was switched. We have children that have literally lost the label of autism.
Hey everyone, this is Jonathan Marx from Go To Health. I hope you're having a great day. Today we're talking about the health of kids, and we have a very special physician with us today who really understands what's called precision genetics. We're talking today with Paula Kruppstadt, MD. She's the founder and CEO of Hope for Healing. She's board certified in pediatrics and she's a certified functional medicine practitioner. She specializes in pediatric care, PANS and PANDAS, and root cause approaches to chronic illness. She practices in Woodlands, Texas, but she does see people nationwide virtually. She's got a special wellness blueprint test that you can take for your child, which shows genetic makeup of your children so you know what to expect. So welcome to the show, Paula Kruppstadt, MD. How are you today?
I'm doing great. Thanks for having me on, Jonathan.
Good, my pleasure. So tell us, what is pediatric functional medicine and what does it encompass?
Great question. So, functional medicine is a way of looking at the body as a whole. And it's called a systems biology approach, meaning we have all these systems in our body. And instead of siloing diagnoses and symptoms, it's taking the 40,000-foot view and trying to determine, is there an underlying root cause for every single symptom that we have?
Ah.
So that's just kind of a broad overview of pediatric functional medicine.
And does pediatric functional medicine differ from functional medicine in adults? What distinguishes it?
Well, we all know that children are not little adults. So the premises of functional medicine are the same, the way that we approach adults and children, but there are different needs based upon age and stage of growth and metabolic rate. So kids get well quickly, but we now have the sickest population of children that we've ever had in the United States.
Why do you say that? What's making us so sick? What's making the kids so sick? What's going on?
Yeah, well, it's not that our genes have changed, it's that the toxins in our environment have changed. From
Mm.
the time that I grew up, I was born in the early 60s,
Hmm.
and when I grew up, we had a lot of new processed foods like hamburger helper, things in boxes, conveniences, but
Yes.
also plastic, Tupperware, all these kind of things. And the environment became much more toxic too. So using lots of herbicides and pesticides and glyphosate. So
Yes.
now we've come full spectrum. We're now using glass and stainless steel and trying to remove forever chemicals from our environment and our households. So the difference is the toxic load and the toxic burden.
Got it. Thanks for mentioning that. So you were starting to go to my next question. What primary lifestyle recommendations do you encourage your families to make to set them up for success with their kids?
80% of the power that parents have is in their kitchen. And it's like taking back the fact that as a parent, you have the authority and you have the ability to bring nourishing things into your household. You don't have to kowtow. It's like you want to create this beautiful, clean sanctuary of eating. So I start with parents using whole foods,
Hmm.
fruits, vegetables, organic when they can, looking at environmentalworkinggroup.org, the Dirty Dozen, the Clean 15. You don't have to buy organic for everything, but the ones that are called the Dirty Dozen do that. Buy those organic, shop the periphery of the grocery store. And if you teach your kids to read a label, and if they just start noticing, you flip it over and you look, and they can't pronounce the words, or you as a parent don't know, it's like, I don't think we need that. That doesn't sound like real food. So, real food, having a bedtime routine,
Mm.
minimizing blue light before bed, or having blue light blockers, and actually sitting down and having meals together back at the nutrition. So, real foods without preservatives, reading the labels. We're looking at fruits, vegetables, poultry, meat, grass-fed beef, those kind of things. And one little hack that parents can do is elevate the head of the bed by just a small amount, like a quarter to a half of an inch. Why? Because in 2014, we learned that there's a system in the brain called the glymphatic system, not the lymphatic system,
The
like our lymph nodes,
glymphatic. Okay.
lymphatic. And when you elevate the head of the bed, when you go to sleep, that's when growth and repair factors are released, and gravity will pull out toxins out of the brain.
Wow.
So that's a little hack. And then movement. So many of our kids are sedentary
Yeah.
and they don't move. And so turning the devices off, getting them moving, and removing toxic exposures as far as people go. You need community with people who support your own family values. And as much as you can provide a nurturing environment that's life-giving. And then for us as parents too, we have to set the example. Now I'm on the other side, I'm a grandparent. I didn't find functional medicine until I was about 50. It's several years
Ah,
later
this is
now.
new. Yes.
Yeah, so it was, I made all the mistakes in the book. Um, Movement, hydration. Many of our kids don't drink enough water,
Hmm.
and parents think, well, we need juice, we need this, and that raises their glucose, then their insulin, and we've created this whole generation of type 2 diabetes in children. I see
Yeah.
so many kids with pre-diabetes. So
Mm.
by removing juices completely, all they need to be drinking after age 3 is water. They
Mm.
don't need milk at that point in time. I mean, that's a kind of a pharmaceutical food lobby thing, and that we think we have to have it, but we really don't.
Interesting.
Yeah. And so those are the premises of functional medicine.
Good. You mentioned at the beginning of the list having dinner together as a family. Tell us, what's the significance of that? Because I know so many of us, both parents have jobs, we've got busy lives. What's the importance of having a family dinner together?
Well, in this day and age where maybe both mom and dad work and everybody's involved in different activities, and that's another thing is that saying, why is my kid doing this? Do they even want to be doing this? Are
Hmm.
they exhausted because you're running from a soccer game to swimming to lacrosse and this and that? And it's like, does the kid even want to be doing that?
Hmm.
So when we sit down together as a family, make it a mom and dad can control this, but no arguments,
Mm.
uh, to try to keep the discussion calm and think about cultivating gratitude as a parent, such as what was the best part of your day? Because our parasympathetic nervous system, that's rest and digest, we do so much better when we're not in this sympathetic fight, flight, freeze, or fear,
Yeah,
frenetic
yeah,
lifestyle.
yeah.
So if we take a little bit of time and we stop and regardless of what people's religious convictions are or whatever, we all need gratitude in our lives. So
Mm.
going around the table, mom, dad, the kids, saying, well, I'm really grateful for this today,
Mm.
taking a few seconds, breathing, moving yourself out of fight, flight, freeze, or fear, which we're always living in that, and then calming down. And that helps us digest our food. And you're creating memories, even if it's short and sweet, but it's a time to cultivate that. So that's the importance of eating meals together as a family.
Good. Thank you so much for that. That's so meaningful. Tell me about genetic vulnerabilities. Now, one thing that I've learned over the years in doing these shows is, we all have genetics to us, but really the genes don't necessarily have to be expressing themselves. And it really is about your environment as a determinant of whether they express themselves or not. So, how do we handle or how do we minimize the risk of development of neurodevelopmental challenges? I'm thinking about maybe autism or dyslexia or ADHD. Is there anything we can do to minimize those coming out?
It's a great question. Creating these really good habits for the family. Now, there's a lot of confusion when we think about genes. There's things that can be turned on, turned off. That's called epigenetics.
Hmm.
But there are a few things in our bodies that have what we call rate limiting steps or non-epigenetically modifiable. It's like you get what you get and you don't throw a fit. And think about it from chemistry. You go from A to B, there's an enzyme, and there's little things called cofactors, and you can only make so much of the end product. So, what we have done is we have interrupted normal DNA synthesis and things and poured these toxins into our kids' bodies and environment and all these other things. You can't avoid it, it's life.
Yeah.
But by identifying, and when I say genetics, I'm not looking at where you're from or what your culture, your ethnicity is, and I'm not looking at deletions or additions to chromosomes. Looking at single little changes in a base pair called a SNP. It's called the single nucleotide polymorphism or variant. And our bodies are symphonies, and we have inflammation. We have, there's different types of inflammatory markers. Then we also have the way that our body cleans house. And it's called autophagy, where you
Mm.
take fuel from the bloodstream, glucose, and bring it into the cell. And then the cell, if it's able to do that, it can send debris and garbage out of the cell into the bloodstream. That's called, and then it goes to the liver, the kidneys, the skin, the lungs, and we sweat it out, pee it out, poop it out, or breathe it out.
Yeah.
That's called detoxification. And then there's um, a way to pull in certain types of B vitamins and different types of ways to stimulate our mitochondria, which are the batteries or the powerhouses of the cells and make ATP.
Yes.
So when I say all of those areas, when I talk about genetics, that's what I'm talking about. Like if I have a family that comes to me and all of a sudden their child stopped developing and they regressed, and then we look at their life and we look at a timeline and try to figure out where what happened, and then look at their precision genetics, and we can give things and take things away that will allow that symphony of the body to work appropriately.
So tell us a little bit more about precision genetics. What do you mean by that, and how do you practice that with your
Mm,
parents?
Great question. And I'll just go ahead and bring this out because precision genetics changed my life.
Hmm.
Uh, I had ballooned up to about 300 pounds. I was clinically depressed.
Wow.
And I did this little evaluation, and it allowed me to get off antidepressants
Hmm.
and lose weight and just come out of this hole I was living in. Plus, three out of my four children have autoimmunity, and never once was I asked, say, for example, by the rheumatologist, well, what does your child eat? They
Hmm.
don't even talk about it.
Hmm.
So, precision genetics, this is what it is. It's like a little box that we can drop ship to people, and parents can do this at home. It's a little swab. It looks like a mascara wand.
Yes.
And basically, you just have your child open their mouth. Adults can do this too. And you just gently paint circles on the inside of their mouth, and you're just getting cheek cells.
Yes.
Or you can lift up the upper lip and do it beside that little piece of skin.
Hmm.
And by precision, I mean that when we get these results back, I use a company that helped me to create a proprietary panel, and it shows those areas. So when your house is burning, what do? The first thing you do is you put the fire out. And
Hmm.
so we always start with inflammation, and that is the driver of all illness and all disease is inflammation.
Got it. So how can people get this kit? And if they're not in your geographic area, can they still get the kit and have you do the analysis for them? Tell us about that.
Yes, we do this internationally. We have a website. It's called Get, the number two, the root.com. And we have a Shopify store. And you
Hmm.
can go on there and purchase the Wellness Blueprint. And we do those reviews around the world. We have patients in Romania
Hmm.
and
Wow.
Switzerland
Wow.
and,
Wow.
now, if someone wants to come in and see us, we're in Texas in the Houston area, but I also have a Florida telehealth license. But the genetics can be done anywhere, anytime. And we have two genomics providers. And so it's just a real beautiful way to say it's a gift. I think it's a gift. It's not negative. It's all like, what can I do to optimize my child's life or my own health? Because we
Hmm.
see adults here and I see adults too, but I focus on kids.
Yeah.
Uh, and so that's how they can find us, that little Shopify store that's attached to our website there.
Now, there's a cost to that, I assume?
Yes, it's approximately $1,500.
Okay.
That's the test. There's an orientation and you can watch that as many times as you need to.
Yes.
Then there's two one-on-one visits virtually with our genomics providers.
Okay.
And it truly is transformative. And, you know, if families have a child that is autistic or struggling with dyslexia, all these things
Hmm.
that oh my gosh, it can help so very much and really change the trajectory of their child's life.
So even if the child has autism or ADHD or whatever, and you do this test, I mean, what things can be done to improve the quality of the child's life?
Absolutely. In fact, uh, we have children that have literally lost the label of autism, and you
Hmm.
don't hear about that in the news. I mean,
Hmm.
and parents second guess themselves, and I'm like, no, you went to a premier children's hospital in the city of Houston, were given the assessment of level two, level three, level one autism. But now that we've discovered all these other things, and we've provided your child's body what they need and removed what they don't need,
Hmm.
and your environment too is clean, then you can recover. We have children beginning to speak and these
Wow.
kind of things. So there's hope. When you go and you're assessed, it's like, okay, the only evidence-based therapy is going to ABA, applied behavioral analysis, get your affairs in order because when you're no longer around, who's going to take care of your child?
Hmm.
And what kind of hope does that give people?
Yeah.
Zip nada. It's very depressing.
Yeah.
So we're all about delivering hope and um, giving solutions that can turn things around.
Wonderful. Let me give that website again because this is so important if you're really concerned about your child or they have some kind of disability. It's gettotheroot.com and that's get and then the number two, the numeral two, gettotheroot.com. So, doctor, let me ask you also about PANS and PANDAS. And my understanding is because I'm aware of a number of families whose children have this, this is, I understand, a relatively new diagnosis. And I guess we're learning more and more about it because more and more kids are getting this. But explain what PANS and PANDAS is. It's so debilitating and it's so upsetting for families. Let's talk about it a little bit.
Yeah, this is something that I deal with and see almost every day that I'm in our clinic seeing patients.
Wow.
And the acronym is pediatric acute, meaning kind of almost overnight onset neuropsychiatric syndrome.
Hmm.
And then PANDAS is a subset. PANS is kind of like an umbrella. And
Hmm.
then PANDAS stands for pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections.
That's what it was. Yes. So you get this
Yeah.
from a strep infection.
Yes, that's a subset of this, but
Yes.
basically, It's brain inflammation that shows up typically with an abrupt onset almost overnight. Like a parent goes, it was like a flip was switched, or they get basically any organism that can cause a fever can
Mm.
cause PANS. All
Wow.
right.
Wow, wow,
There
wow.
is not one test to say, oh my gosh, yes, you've got it.
Hmm.
It's um, it's a clinical diagnosis, and there's an excellent website that I'd like to share. It's called aspire.care, ASPIRE.care.
Got
It's
it.
the premier international website for this. But basically, for PANS, you have to have that acute onset of obsessive compulsive behavior or severely restricted eating, and then 2 out of 7 other criteria like anxiety, separation anxiety, behavioral regression. Your kid might start talking baby talk,
Mm.
school deterioration, performance, bedwetting out of the blue, or a need to pee all the time.
Hmm.
And then other somatic things like, well, I'll just say visual and auditory hallucinations. And many times when people look at their kids, their pupils will be dilated, and it's like they're like another
Mm.
creature,
Mm.
almost possessed sometimes.
And
And then,
is this predicted at all, or can you avoid it, or does this just happen?
I'm really glad you asked that question, because when we do these precision genetics, we can
Mm.
see vulnerabilities if a
Mm.
child has a very explosive immune system,
Uh-huh.
or the inability to turn their immune system off. And there's also little markers on these genetics where they hold on to viruses.
Uh-huh.
So basically, when you think about this, we think about like herpes simplex virus that causes fever blisters. We think about parvovirus that causes Fifth's disease, slap cheeks, hand, foot, and mouth, Epstein-Barr virus that causes mononucleosis, and then um, uh, just all kinds of influenza.
Hmm.
Basically, anything that can give you a fever. COVID. I've seen post-COVID encephalopathy, where
Yes.
kids go crazy, and they may not have even had a fever when every member of their household was sick because their immune system does not function normally. Um, for the PANDAS side of the house, where you've got the strep. Now, PANS, even though it has pediatric, there's no age onset. Adults have even gone crazy with this
Hmm.
too.
Hmm.
Skin picking and eating disorders. In my practice, every single patient in my practice that has gender dysphoria has PANS that we've
Hmm.
tested. Oh, also, you can't exclude like vector-borne illness, which is like Lyme disease, Bartonella, Babesia, tick-borne relapsing fever. But PANDAS, they say the age of onset 3 or higher, but I've actually seen that in a 1-year-old who was screaming when her mom ran the bathtub. And I said, does anybody in the family have strep? And the grandmother said, oh my gosh, my adult daughter does. And her 1-year-old child was all of a sudden afraid of the bathtub. So with
Wow.
PANDAS, ticks, vocal, motor tics, sleep disruption, those kind of things. So that's kind of PANDAS in a summary.
Got it. That's scary
Yeah,
stuff.
it
I
is.
mean,
It
yeah.
is.
So I guess there's a lot of scary stuff we've just discussed here.
One thing, Jonathan, I think that's really important is that if parents suspect that their child, like they have this overnight change, and for whatever reason, I don't know, in the ivory tower of the academic institutions, we have believers in PANDAS, and then we have naysayers. And,
Yes.
Stanford has a whole group dedicated to that with,
Yes.
a rheumatologist, a psychiatrist, allergy immunology, gastroenterology, and then you've got a hospital here in Houston, and they're like, oh, there's no such thing as that, where they have a child in front of them
Hmm.
with positive labs that's going crazy, and the parents are pleading for help.
Sure.
And so, if you're that parent and you don't have a listening ear, I would say when you're appealing to medical people, Dr. Smith, PA Smith, Nurse Smith, with all kindness and respect, say, would you please just take a look at this PANDAS network or pandas.org website or this aspire.care website, and just please just partner with me. Even though my kid's throat doesn't look red, would you please swab it? Would you
Hmm.
please draw their blood? And sometimes you may not have strep in the throat or the nose or around the anus. Like we'll do a little swab right around the booty tootie there.
Yes.
And the the reservoir of the infection could be up in the sinuses, it could be in the gut, it could have been from an old skin infection that triggered this cascade. So there are many ways to address this, but with your own grandchildren or with anyone listening, is if they do see this overnight change, look at that aspire.care website and get armed with that. And there are providers that will believe you. And you can also just advocate for your child. Take them in, get a respiratory swab, get a throat culture. Don't just do a rapid strep. Ask for the overnight culture or 2 to 3 day culture, those kind of things.
Hmm.
And just find someone that will work with you. And there's a lot of really great doctors who may not know a lot about it, but as long, most pediatricians, they're kind-hearted and they love kids. That's why they do what they do.
Yes.
And if you're just kind and respectful, and hopefully you catch them on a good day, hopefully they'll draw these things for you.
Good. So, Paula, are there questions I didn't ask that I should have asked, or is there a big message you'd like to leave with people today?
Thank you for the opportunity to just think on that. I would just say that if you're discouraged and you are seeing things in your children, there's always hope. And I would also just encourage everyone, because this is what changed my life, this Hope for Healing Wellness Blueprint. But um, when you're working with your kids, speak life-giving words. We all carry our own baggage into our parenting and how we were raised, and those negative things that our parents may have said. And, they were doing the best they could, or maybe they weren't. Okay. I
Hmm.
don't know. But um, the past is the past. We have a fresh start and we can use those life-giving words. So cultivating gratitude and being an advocate for your child. And there's no one more impressive than a mama bear who
Hmm.
is an advocate for her child or grandparents. And, people just need to be heard and seen and know that they're cared for. So I would just say cultivate gratitude and lean into those genetics, because it's a whole new way of thinking. We're so reactive. We're in the pill for the ill instead of being proactive.
Hmm.
I'm looking at my family. I don't have to have cancer like every member of my family. I don't have to have this or that. I want to set a new precedent. And by doing those genetics, that gives you power to change the trajectory of your child's life or your life.
Good. So inspiring. Thank you so much, Paula, for being with us.
Well, thank you, Jonathan. I thank you for the privilege.
We've been talking with Paula Kruppstadt, MD. She's the founder and CEO of Hope for Healing. Love it. That's what she's been talking about. She's a board certified pediatrician and certified functional medicine practitioner specializing in pediatric care, PANS and PANDAS, and root cause approaches to chronic illness. Hope for Healing, her practice, is a functional and regenerative medicine practice based in Woodlands, Texas, providing personalized root cause care for children and adults. Again, Paula, thanks so much for being with us today.
Thanks for having me, Jonathan.
Good. This has been Jonathan Marks. Remember, you can subscribe to us at gotohealthmedia.com. We're also on YouTube and 8 podcast networks, so please subscribe so you get all our shows. And if you like what we're doing, please give us a thumbs up or a 5-star review. That helps us get the word out to more people, all about evidence-based medicine. This has been Jonathan Marks with Go to Health, and as we say at the end of every show, go to health. God bless. We'll see you again next time. Take care.